Hey, I'm Teresa. I'm a dental hygienist. I've been doing this for 40 years. I had a really bad experience as a child in the dental chair. Was not very good at my home care. When I was 16 years old, and instead of my hygienist preaching at me, she actually taught me how to take care of my teeth. Through the years, I have learned tips of the trade. I'm going to teach you how to take care of your teeth and make your dental experiences a much healthier and happier place. Hey, welcome back. Hope you're enjoying the videos thus far. Today we are going to be talking about implants versus your natural teeth. You have choices with your teeth to fix your teeth. You have teeth restorations, or they're called fillings. You either get the white fillings or the silver fillings. Most everybody is doing the white fillings today. The second thing is a crown. The crown goes over the tooth. They grind the tooth down and they put a little crown over the top. That protects the tooth from breaking. If you have the nerve die, you need something called a root canal, where they go in and they kill the nerve and they fill it full of a substance so that you don't get infection in the empty canals. Then once you've had a root canal done, you have to get a crown on the top, because you take the nutrients out of the tooth and the tooth can become brittle and break. So you have to have a crown on top of a root canal. The fillings, sometimes they can be small, sometimes they can be big. And the other thing is the support of your bone. You have to have good support, whether it's healthy or periodontal disease. You have to have enough height and enough width around your bone to support your teeth. Okay, so I have seen the commercials on TV and I just turn it off, because it's kind of entertaining to me. So what they're advertising, and I'm not knocking anybody, is implants are great. We have patients that have them. If you have periodontal disease, they make it sound like you just have to pull all your teeth out, get your implants in, and life is going to be fabulous. That is false. Okay, yes, your teeth can be fabulous with implants, but there has to be a maintenance program with your implants. If you have periodontal disease around your teeth, when you remove your teeth, you have just cured periodontal disease. However, with the dentures that sit on your bone is going to deteriorate over time because it's no longer needed. It's going to resorb back. If you place an implant in, it's going to secure that bone back into the spot. However, if you have periodontal disease, you can get infection around that implant. So you have to maintain at least every 3, 4, or 6 months with your implants, depending upon the healthiness of your mouth. So just because you get an implant, or you think, we have patients that come in I just want implants, I just want implants. There has to be enough width and enough height to support the implant, just like it is with your teeth. So if you can save anything in your mouth, save it, because nothing works like your own teeth. If you have implants, it's going to take about 3 months to heal on the bottom before they can even load it with a tooth. On the arch, it can take up to 6 months. If you have to have a graft, which means that they have to put extra bone in to help support the implant, that can take 9 months or longer for everything to heal, depending upon your body. After you have the healing process, it takes about 2 weeks. So an average implant can take up to a year to get it completely squared away, just depending upon where it's located. After you get your implant placed and everything is healed, and usually the surgeon that places it will take an x-ray to make sure that it adheres to the bone. You have little screws. They want the bone to adhere to the screws. An implant usually comes, it'll either bury the implant under the gum, and then they'll expose the implant when they're getting ready to load it. I call it the foundation. So you have a little thing underneath, and that's called an abutment. So what they have to do is they have to expose the implant, screw in the abutment, and then they're going to make a temporary crown for you during that process. After 3 to 4 weeks, and it could take a little bit longer depending on the lab, you'll come back and you'll get your permanent crown cemented or screwed in, depending upon the type of implant that you have. You have to maintain that every 3, 4, 6 months, depending upon how well you're doing your home care and your health histories. If you are a diabetic, or you have had a history of periodontal disease, you have a very high risk of implant failure. Also, if you are a smoker or vape, you are at a higher risk for implant failure. If you have an implant, you cannot use anything metal around your implant. It can scratch your implant and cause your implant to fail. Here is an example of something that you should not use, and these are very popular because when you have an implant placed, you have a very small screw, and then they're going to put a big bulky crown on top of that to make sure it touches the teeth next door. That screw can support the bone because of the load of the teeth. The surgeon knows what he's doing. Okay. This is called a Proxibrush, okay, and it has bristles that are nice and fuzzy and soft, and then it has a metal support. Do not use this because this metal can scratch your implant and cause it to fail. We have special instruments that we use around implants. All right. Implants are very expensive. If you pay for an implant and your implant does not work, you still have to pay for it. I worked in an office where a lady had 2 implants on the lower left. What happened is that I would check and see if I could turn them after that 6-month mark. This one worked, this one failed. She still had to pay for all that work to be done, and it failed. We do not know how it failed. We do not know why it failed. She did not have any underlying conditions, and I'm going to go through those conditions here in just a second. Your body does things that we don't understand, but save your teeth as much as you can. Health conditions that may cause implant failure. Uncontrolled diabetes is probably the biggest. If you have uncontrolled diabetes, implants are not your best choice. Now, it doesn't mean that you can't control it. You can control it through medication. Diet, exercise are probably the best way to control diabetes. Smoking. If you smoke, you need to get off it. If you chew tobacco or dip tobacco, you need to get off it before you start doing it. Smoking deprives the mouth of oxygen. The implants need to have a very blood-induced area or a lot of blood vessels in the area to help everything get healed up properly. Osteoporosis is one. I've had patients with osteoporosis that come in and they can get implants because it is maintaining some of the medications for implants is a contraindication for implants. Certain heart conditions. If you take your biphosphonates, it is to help you build your bone back intravenously. Not a good choice. Certain immune diseases, and your doctor or your oral surgeon will go over that with you. They'll do a very big health screening before they do the implants. Periodontal disease, or if you grind your teeth. If you grind your teeth, it can cause your implants to fail. They may give you implants, and then they may make you a night guard after to protect those implants from failing. Thanks for watching. I hope you enjoyed it. Please floss through the like button. Don't forget to brush through the subscribe. Thanks.